Good morning, doctor. We are from SGDB10. We'll present our student project with the title of Obstruction of the Urinary Tract in Children. Next is the list of our team members. And these are the content of our presentation. Now I will begin with the background. My name is Ibuteka Dharma Mahaputra with name 024. Urinary tract obstruction is a disease when restriction of urinary outflow occurs, which will lead to progressive renal damage when not treated sufficiently. Urinary tract obstruction in children may be caused by congenital or anatomical abnormality and acquired as a result of trauma, inflammation, calculi, and surgical procedure. If not treated properly, may lead to urinary tract infection, bladder dysfunction, hypertension, growth retardation due to bony abnormalities, end-stage renal disease or ESRD, and chronic kidney disease or CKD in children. These are the formulation of problems of our writing, and these are the objectives of the writing. These are the benefit of our writing.
Hello everyone, my name is Putu Emilia Dewi with student number 028. So I will explain about the definition. Urinary tract obstruction or obstructive uropathies is any blockage in the urinary tract, including kidney, ureter, bladder, and urethral, as you can see on the slide, that inhibits the urine flow due to structural or functional cause. Obstruction sites of the urinary tract may differ in each patient. It can be at the level of the uretero-pelvic or uretero-vesical junction, bladder outlet, or even urethra. The abnormalities can be unilateral or bilateral, and it also may affect one or the whole urinary tract parts. The obstruction will increase the intraurinary tract pressure and decrease the urine flow. It occurs in all age groups, however, most of the cases follow the bimodal distribution in infants and the elderly. The urinary tract obstruction may develop from congenital or acquired issues. In children, obstruction mostly happens due to birth defects or embryological urinary tract formation failure, and children may experience some symptoms related to the obstruction, such as urinary retention, difficulty in micturating, and lower abdominal distension. If not well managed, urinary tract obstruction will manifest into progressive renal damage. Urinary tract obstruction also initiates sequential complexes of renal impairment.
Om Swastiastu, my name is Chokoda Isri Intan dalam Skoti with 3-digit student number 231, and I'm going to explain about the epidemiology of obstruction of the urinary tract in children. So approximately 4% of total urinary tract obstruction in children is generated from congenital genitourinary tract abnormalities, such as posterior urethral valves in 64% of all cases, urethral atresia in 39%, and Eagle-Barrett syndrome in 4% in all cases. Urinary tract obstructions are the most common abnormality identified by ultrasound, and approximately 1 of 2,000 pregnancies are having a congenital urinary tract obstructions. And one of the urinary tract obstructions diagnostic feature is the urine backflow to the kidney or hydronephrosis, as shown as this figure below. And the ultrasonography results from antenatal care report about 1% of hydronephrosis cases in fetus. And this figure below, it might be hydronephrosis grade 2 because there is pelvical and calyx dilatation, but the medulla and cortex are still normal. Thank you.
Hello, Dr. and friends. My name is Vinu Fernando Valentin with student number 086. Urinary tract obstruction can result from congenital lesion or can be caused by acquired such as trauma, neoplasia, calculi, inflammation, or surgical procedures. Although most childhood obstructive lesions are congenital, obstructive lesion can occur at any point from the calyx to the tip of urethra. Obstruction can be extrinsic from compressive or restrictive force or intrinsic from a multitude of factors. The most common cause of intraluminal obstruction are calculi, blood clots, tumors, or slug papilla. This obstruction present acutely, while strictures, which is caused by stenosis, cancer, maldevelopment, or iatrogenic causes such as ureteroscopy, tend to develop over time, causing chronic obstruction. Urinary tract obstruction can be unilateral or bilateral. The most common cause of unilateral obstruction are calculi and neuromuscular malfunction at the junction of the renal pelvis and ureter, while lesions in the bladder base or retroperitoneal tissue usually develop into bilateral obstruction. In children, more common causes of obstruction are pelviuretic and uterovesical junction, ectopic ureter, ureterocele, megalureter, and posterior ureter valve. And here are the other common causes of obstruction based on its location. Thank you.
Hi everyone, my name is Daniel Sungutama Sinulingo with the last student number 045, and I'm going to present the pathophysiology of urinary tract obstruction in children. Urinary tract obstruction in children are mainly congenital. It may happen as the result from maldevelopment of kidney and urinary tract in children. Also, abnormalities in urethral or bladder development. Kidney development or nephrogenesis is completed by the 36 weeks of gestation. After the birth, there's no additional nephrons formed. Premature birth has been associated with low nephron numbers since the nephrogenesis is not yet completed by the time they were born. This can result in abnormal development of the kidney, which later can cause urinary tract obstruction. The other abnormalities is an accessory renal vessel emerging from the renal vasculature, aorta, vena cava, or iliac vessel that might cause urinary collecting system disorder. The other cause of urinary tract obstruction is abnormalities of peristaltic function. Abnormal smooth muscle configurations, absence, or hypertrophy in the proximal uretral walls can affect the peristaltic function in the urinary tract. This can lead to urinary tract obstruction. Well, that's all that I can present to you. Thank you.
Good morning, doctor and friends. My name is Putri Tamia Desrianti with name 081. The next one is history and physical. The clinical manifestation of urinary tract obstruction in children depend on the location, duration, cause, and degree of obstruction. Patient may present with symptoms of inability to pass urine or urinary retention, weak stream of urine, interrupted stream, blood in the urine, pain either in flank side or in the back, abdominal pain, swelling, nausea, vomiting, and renal colic. In children, most of the clinical features are consequence of obstruction. Slowly progressive obstruction can lead to hydronephrosis, which is asymptomatic in the early stage, or dull discomfort and pain in the pelvis on the affected side. Ureteropelvic or ureterovesical junction obstruction cause a mass or pain in the upper abdomen or the affected side of the waist. Pyelonephritis can cause sepsis in young infants, and the signs are failure to thrive, vomiting, and diarrhea. When infected, the patient will experience fever, chills, dysuria, and hematuria. Upper UTO in kidneys and ureters may manifest as ipsilateral pelvic pain and groin pain. Lower UTO in bladder and urethra can cause voiding dysfunction such as urgency, frequency, nocturia, incontinence, decreased flow, hesitancy, post-voiding dribbling, and cessation of inadequate emptying. A thorough history and physical examination of the abdomen and genitals are necessary to evaluate and demonstrate the etiology. Kidneys will be palpable if hydronephrosis is severe, especially in children. In infectious process, costovertebral angle pain may indicate pyelonephritis. Possible urinary retention if bladder distension is found. Digital rectal examination is indicated in men and pelvic examination in women.
Hi, my name is Mani and the last digit of my name is 249. Today I'll be talking about the supporting exam. Since the development of ultrasound and its widespread of use to screen the unborn child and UPT obstructions are identified as long as before birth. After birth, symptoms of UPT obstructions may be an abdominal mass, a urinary tract infection, common with fever, flank pain, especially increased fluid intake, stones, and bloody urine. The identification of these issues in utero can improve the overall outlook for these children. and highlighting the importance of the anatomical fetal ultrasound. Obstructive uropathy is likelihood of urinary tract infections, and its urinary tract infection is a common bacterial illness in children. Delay in the treatment of UTI may lead to acute renal parenchymal damage and as well as subsequent renal scarring, and it's well established that several risk factors increase the tendency. Thank you.
Hello, my name is Christian Rawan, student number 040. So let's talk about the diagnosis. The diagnosis of urinary tract obstruction in children is established by radiologic study that include imaging and radionuclide procedures. Next. Each indication and role of various imaging modalities can be seen on the slide. The hallmark diagnosis test for UTO in fetus is identification of antenatal hydronephrosis. The severity of antenatal hydronephrosis is important to determine the possible postnatal pathology and standard plan for antenatal examination. Radionuclide dynamic renogram is necessary to evaluate obstruction and determine individual renal function. However, if radionuclide scintigraphy facility are not available, we can use IVU instead. Thank you.
Hello, my name is Jonathan Edmond with student number 137. Right now I'm going to tell you about management of urinary tract obstruction in children. The goal of management is for total relief of obstruction. There's medical management and also surgical management. For the medical management in urinary tract obstruction, we can give analgesics and also prophylactic antibiotics. The examples of analgesics that we can give are oxycodone, hydrocodone, acetaminophen, and also non-steroidal anti-inflammatory drugs. For the prophylactic antibiotics, we can give trimethoprim, sulfamethoxazole, and also nitrofurantoin, also cephalosporin, and also fluoroquinolones. For the surgical management, we can do radiographic imaging and also suprapubic catheter. For lower urinary tract obstruction, we can do rectal catheter or giving suprapubic tube catheter. And also for the upper urinary tract obstruction, we can do urethral stent and also nephrostomy tube. After management, we can do also reconstruction for those who have some physical damage in the urinary tract, which we can do is ureterostomy or pyeloplasty with mucosal grafts. For the post-operative diuresis, we also give some fluid replacement, which sometimes in cases of post-urinary tract obstruction, patients tend to have hyperdiuresis.
Hello, my name is Putra Neri and I'm number 11. So today I will present about the prognosis of obstructions of the urinary tract in children. In general, the prognosis depends on the underlying etiology, and in acute obstructions tends to be reversible and is less likely to cause damage to the renal filtration system or other functions. However, chronic obstructions can have worse long-term effects on kidney function. If the renal dysfunctions persist or worsens, long-term effects may require hemodialysis or kidney transplantations. And the overall prognosis of urinary tract obstructions can also worsen if it is accompanied by concurrent and untreated urinary tract infections. And in congenital urinary tract obstructions, the long-term prognosis depends on the degree of abnormal nephron development and on the severity of bladder and kidney dysfunctions. And infants who have poor renal functions after several weeks of stabilizations and bladder drainage have a significant risk of developing renal failure and often fail to reach adulthood. And patients undergoing surgical corrections of upper or lower tract obstruction should be monitored closely into adulthood. And most children with significant congenital urinary tract anomalies may develop renal failure in adulthood.
My name is Pierre Joshua, last digits of student number 077. So there are two main complications that can occur from urinary tract obstruction in children. The first one and the most common complication is acute kidney injury up to chronic renal failure, and second one is urinary tract infection. Chronic renal disease caused by urinary tract obstruction is mostly from a condition known chronic bilateral obstructive uropathy, which is a chronic urinary tract obstruction in both left and right kidney flow. and this complication have a bad prognosis and will keep worsening if not treated. And the second one is acute kidney injury. It's a cluster of syndrome engaging multiple organs with high mortality rates that requires advanced intervention. Patient with this obstruction in pediatric patient will have congenitally, if continued for a long time, will eventually become chronic, which is characterized by fibrosis. And the last one is urinary tract infection. There are two types of infection, upper urinary tract infection and lower. The upper is also called pyelonephritis and the lower is called cystitis. In normal patient, the urinary tract is one-way flow, but in children with obstruction, there can be stasis flow or even reflux, and this what cause infection and spreading of infection. If caused reflux, will cause spreading from lower urinary tracts to the upper up to pyelonephritis.
Good morning, Doctor and friends. My name is Sharon Kalista with student number 051. Now we move on to the summary of our student project. So, urinary tract obstruction is a disease when restriction of urinary outflow occurs, which will lead to progressive renal damage when not treated sufficiently. In children especially, urinary tract obstruction mostly caused by congenital genitourinary tract abnormalities and others are acquired as a result of trauma, inflammation, calculi, and surgical procedure. With the pathophysiology which are related to maldevelopment of kidney and urinary tract in children, abnormalities of urethral or bladder development, and dysfunctional urethral peristaltic. The clinical feature of urinary tract obstruction in children are varies according to the location, duration, cause, and degree of obstruction. Supporting examinations such as ultrasonography are useful to identify obstruction long before birth, and radiologic studies are helpful to diagnose the obstruction. Management of urinary tract obstruction, including medical and surgical, with the goal of treatment is to relieve the obstruction. And last but not least, we need to be aware that most of children with congenital urinary tract anomalies might develop complications such as renal failure in adulthood. Okay, move on. Here are some of the references. Alright, doctor and friends, that's all for the student project presentation from B10. Thank you for your attention and stay safe.